Thank you, Mr. Chairman. Today for most insurance plans, mental health parity is the law, but it sure doesn't feel that way for people who need help. A 2015 survey conducted by the National Alliance on Mental Illness found that nearly 50% of respondents had been denied coverage for mental or behavioral health care, compared with only 14% denied for physical health care. And I hear way too many stories from people in Massachusetts about how hard it is to get insurance coverage for the care that they need. So let me start here. Dr. Hepburn, what do we really know about how many people are being denied services they need, why they're being denied, if they are filing complaints, and if they ever end up getting the care that they need?
Yeah, it's an important issue. Yesterday I called the Maryland Parity Project because I wanted to get an update. And what they indicated was that it's very hard for them to know what the numbers are, because when people look at how difficult it is to submit a request for a review, it's so tedious and it's so detailed, it's going to take months to years to make a difference. So I asked for a recommendation, and they said something has to change in the process.
Okay, well, let's talk about that in just a second. But let's start with what you're saying here. We just don't have even good data on this,
No.
on any of those four questions. Mr. Rahim, if someone had trouble getting insurance coverage for mental health services, is there one place that anyone in this country could report a problem and get some help?
That I'm not sure of, and being that
I think that's the information we need
that's
right
what
here.
I'm saying. Being that I'm a
We
mental
just
health
got it.
advocate, and I don't know that speaks to that.
Okay, and that's part of the problem we've got. It's hard to fix any problem if we don't have reliable data. So Connecticut created an Office of the Health Advocate to try to help people navigate the insurance system and assist when they were denied coverage. In 2014, that office returned nearly $7 million to consumers. The most frequent cases they deal with every year, denials of mental health coverage. So my colleague from Massachusetts, Representative Joe Kennedy, introduced the Behavioral Health Coverage Transparency Act last month to try to create a patient parity portal to provide consumers around the country a one-stop shop for information about parity and a central place to submit complaints about coverage. So let me ask you this, Dr. Hepburn, and we'll go back to the question about what to do about this. Would a central place for people to go with problems about insurance coverage for mental health problems help consumers and give regulators better information about where to focus their enforcement actions?
Absolutely. Yes.
So this is something that could make a real difference.
Yes.
From what you're saying. Good. I just want to say, as this committee goes forward on mental health legislation, I would like to work with you, Chairman Alexander and Ranking Member Murphy, on making sure that consumers have a central place to turn to for help when they are denied coverage, and a central place where we will get the information so that we can enforce the law that's currently on the books. Thank you. Thank you, Mr. Chairman.